Okay, colleagues, it looks as if we are at the moment on 21 attendees. So I think let 22 now, let us start. 56 people signed up for tonight's webinar, number 4, but we do realize that the time may be inconvenient. It is a little bit earlier than what we used to do. So for tonight, we have a 2-hour session, but it is 2 separate events taking place. So the first one is our webinar number 4, our Eastern Cape webinar number 4 from 6 to 7. And basically what we say is everybody's welcome to join us. And then the very relevant and very interesting topic tonight, the ethical implications of AI for health professions education. And then from 7 until 8, we're going to have our SAAHE Eastern Cape Annual General Meeting, where we only want the SAAHE Eastern Cape members to be present, and there's a separate link for that meeting. So colleagues, thank you very much for joining tonight. Let us start with our webinar. The webinar will be recorded. Tonight, as I said already, ethical implications of AI for health professions education. And yesterday evening when I was preparing for this, I actually wanted to know how much has been published in this area and relevant and how topical this topic for tonight is. And to my surprise, I was quite impressed when I saw how much research and how much is currently being published on the topic. This is one of the advantages of being a member of SAAHE, obviously, is to become familiar with the latest developments and what is happening in the field, and to hear from the experts, and also very importantly for all of us to learn from each other. So if you are attending tonight and you're not yet a member of SAAHE, and whether Eastern Cape or rest of Southern Africa, please join SAAHE. Here you can see the SAAHE website where you can register to become. You will see on the right-hand side, just next to contact, how you can register to become a member of SAAHE. So we encourage all of you to join SAAHE and become part of our family, where we learn from each other and where we together stand together to, for health professions in education to better teach our students. So the relevance of this, I typed in, like not a good scientist, into Google last night, the ethical implications of AI for health professions education, and I got 158 million hits in 0.58 seconds. So I thought, okay, definitely a relevant topic. And then I did the same, and I typed in Donald Trump, because I do think you will agree with me, Trump is quite popular at the moment and quite well known. And for him, I found 877 million. So if we compare 158 versus 877, then I do think tonight's topic is really relevant, and there's a lot going on in this field. So hence, I think tonight is going to be, I hope for all of us, a good learning experience, and also a good opportunity to interact with each other. Okay. So I just want to go to the next slide. So our program for tonight, I'm doing the very short welcome, and this is literally where I'm going to stop. I'm going to hand over to Dr. Rian van der Venter. Thereafter, Mr. Neil Cram, then Mr. Rais Khan, then Mr. Daniel Brink, and then there will be a panel discussion of 15 minutes where all 4 speakers will be debating and discussing, and then we are going to open for questions from participants, and then I'm going to have a few final words. Our 4 speakers for tonight, it is my privilege to introduce Dr. Rian van der Venter. I think by now, if you have attended any of the previous webinars, you will know Rian. that Rian is a lecturer and a researcher in the Department of Radiography at Nelson Mandela University. And you can quickly scan his professional background and his short bio. Just to say that Rian is also an NRF-rated scientist and that he also has international links. So he's also working in international teams, and then he's also obviously involved in publications and an associate editor and co-editor for journals. So I'm not going to read his full CV for the sake of time. Mr. Neil Kram, very welcome tonight, a sociologist and educational technology specialist and academic in the Center of Higher Education Research, Teaching and Learning at Rhodes University. And I love what you had on your CV. I have a passion for all things education. I love working with technology, finding out what works and pushing innovation in education practice. I'm an instructional designer who aims at perfecting my approaches to learning. I'm a seasoned researcher that loves asking questions and challenging myself and others. That's brilliant. I believe that there's always a better solution to every problem. We are looking forward to learn from you tonight. That is an amazing statement that you've made in your CV. Then Mr. Rais Khan from Nelson Mandela University. He joins us in his capacity as a senior instructional designer in from the medical school at our university. He holds a bachelor in education. You can read his background. I think his experience tonight, we're going to learn a lot from you, Rais. So very welcome also, and thank you for your making yourself available to be part of this team of presenters tonight. And then last but not least, Mr. Daniel Brink, our emergency medical care practitioner. You have already met him in one of our previous webinars, where he is very interested in health professions education and also the teaching of students. And Daniel, I love your way of trying new things and your inquisitive mind. So those are our 4 speakers then for tonight. This is where I'm going to stop for tonight and say, Rian, I'm handing over to you for introducing us to responsible AI defined. Thank you very much.
Thanks, Prof. Someone let me know if you can see my screen.
See your screen?
We can. You
Thank
must just
you.
put on presenter mode. Perfect. Thank you.
In present. Okay. Hello, everyone. So my aim today is to just share and set the scene for the rest of the speakers on for a common understanding of what responsible AI is, and then using this to as a benchmark for our panel discussion. So if you look at all the icons on the screen, I'm sure to many of you they are familiar, and you've probably used most of them, and you use many of them every day. And the question is, when you use these, do you feel guilty? And you can reflect on that question as we go through tonight. And they take various forms where you punch in a question, or they would show you that something is not kosher and you can then edit your work, but also then asking questions and getting answers from a chatbot, for example, on e-filing. So then that brings me to the affordances and limitations to AI, and I've tried to summarize some of the common ones, and that the message here is that we should exploit the affordances, but that we should not forget that there are limitations. And the only way that we can exploit the affordances is if we become AI literate. But also then, while we become AI literate, that we try to ask those questions that we are bothered by that speaks to the limitations, so that we can adopt AI in a more equitable manner but also that we are able to explain what AI is actually doing. And then that's where explainable AI comes in. So that when we get asked a question, that we can then also account for AI's possible mistakes or the probability of something being accurate, and then that we understand that when we get a result from AI, that we can judge the credibility thereof in a more informed manner. And if we look at what's on the screen, we can see that with the affordances, it allows us to be more efficient, and the idea of a support tool or a support aid comes to the fore. But then it also helps our students to focus on the more higher order type of thinking skills that we would like them to develop, and gets them to be actively part of their learning, which speaks to the teaching philosophy at Nelson Mandela University of humanizing pedagogy, where we would like to empower them and help them become liberated beings, cognitively speaking, so that they are able to develop their own understanding of particular concepts. But then to do that, we need to teach them how to use AI responsibly so that we can overcome these limitations. So when we speak responsible AI, what do we mean? Colleagues and I looked through literature and we did a rapid review to come up with a definition that you are seeing on this particular screen, in saying that responsible AI is not just the four ethical principles that we are used to as healthcare practitioners, which is autonomy or respect for autonomy, justice, do no harm, which is non-maleficence, and beneficence. It goes beyond those principles. It also extends into integrity and trustworthiness. When we speak conceptualization, design, use, critical appraisal, and even monitoring AI tools that we are using. And you can see on the screen some concepts that speaks to the broader concept of responsible AI. Things like equity and fairness. So how do we train the algorithm? Can it make proper decisions for that particular context, for example? When we would like to use or design our own tools, we need to work in teams of different experts so that we design fit for purpose and responsible algorithms to help us. When we do research using AI, we need to use it ethically and not use it to do our work for us, because we ultimately are responsible for the evidence we put out and put our names to. And the human will always be in the loop. AI cannot make all the decisions in the current forms that it is. There's always the possibility of errors creeping in, and that's where the human factor comes in. So the bottom line is that AI will remain a support tool to us to improve efficiency, because as we move into Society 5.0, there's this integration of technology, the Internet of Things, AI, and then society, to then create this technologically advanced society to solve societal problems that becomes more and more complex in a more seamless way, using technology and the humans alongside one another. So that's where I'm going to leave you and the seeds I have planted, and we'll listen to my three colleagues on their perspectives specific to their context on AI and how they feel about the ethical implications thereof. Thank you. So our next speaker is going to be Neil from Rhodes. And Neil is going to speak about generative AI, or for short, Gen AI, in healthcare education and the implications for teaching, learning, and assessment. Over to you, Neil.
Thank you so much, and thanks so much for having me. Yeah, sorry, I'm not going to put on my camera because I'm at Mpukweni on a writing retreat, and the internet is not behaving. It never does when I have to present for some magical reason. But regardless, I mean, today, I think this topic is more pertinent than ever. I mean, generative AI launched 2 years ago, and I've been reading the literature around AI in higher education for a number of years, looking at all the promise and all the peril and all of these things. And then the bomb hit with something as simple as ChatGPT. Now, I don't think that we are in a lot of trouble right now. I think we're in this mid space where things can change into different directions. I mean, new models are coming up, and I mean, it's going to be an interesting ride for the next, I think, 3 to 5 years. Unfortunately, for all of us that's in education, it means that things are going to change consistently or constantly. And I think when we look at healthcare education, I mean, the literature is actually quite vast, but all of the literature I read says that we need to actually do a lot more because we don't know. And the scariest part is a lot of the current literature, if we ask, where did our students learn about AI? They learned it from social media and about 60% of the time. And all of those are, well, use this bot to write your essay, use that bot to help you do this. So it's a solutions and a game that we are playing in that scenario. But again, a lot of energy has been spent on looking at assessment. But I do want to say because I want to talk about assessment very briefly. But along teaching and learning, I think in HPE there's an imperative for us to actually, as educators, number one, work with AIs ourselves. So if you haven't, it's not the biggest curse, but we're going to have to. These are the things that's going to stay with us for a number of years. It's going to change the whole society. This is a quote from Joseph Ayun. It's a book he wrote in 2018. I mean, I don't think he's far off. It's a fabulous book. If you're interested, I'll put the link to the book in the chat after I speak. But I mean, regardless of the challenge in front of us, the question is, what should we be doing? And I think AI has not necessarily broken higher education. It's just shown some of the fault lines that we have already. And I'm going to illustrate this with well, a colleague and my PhD supervisor published a paper on authentic assessment and how we should think about it. But I think the concept actually really gives us a way to think about what does ethical teaching, learning, and assessment mean. And I think it's about, if you look at the image, so I'll put the link to this in the chat as well. It's a chemistry education paper, so I think it could be quite relevant. But Max makes the argument to say, on the left-hand side, we get students that come into our classrooms. On the right hand is where we want them to be, right? Qualified, in this case, healthcare practitioners. And to do that, we need to introduce them to the disciplinary knowledge, the knowledge that's core to our different disciplines. And I know everybody's got their own way of doing things. So that's where you have the support, the nature of discipline. Now, I think our challenge lies in the nature of the discipline and the disciplinary knowledge. How do we connect that to AIs that make sense? Because as sure as we are here, it is going to transform what we do. The tech bros are coming for us in some form of way. And I think the only way that we can really get around this is by focusing on developing evaluative judgment among students. That is getting them to evaluate not just their work and the work of others, but being able to evaluate the work of these bots, all right? be it an image that's being checked, or a diagnostic machine, or a virtual patient, being able to apply the disciplinary knowledge and the nature of the discipline requires that. And that is all supported by assessment that's going to support the way these students are going to work in the next 5 to 10 years. Now, I don't think South Africa is a special case. I worry that we always say we are special. Every country says they are special. But we are not special. I think we are different, and our infrastructure might be different. But we are going to have to harness these things in very effective ways. And that's, as Rian said, what is responsible AI? Yeah. Thank you. Sorry. I think I'm actually over time. My timer didn't go off.
Thanks, Neil. We're going to move to our next speaker, which is Raiz. And Raiz is going to give us an instructional designer perspective and the impact of AI or the implications thereof for instructional design. Over to you, Raiz.
Thank you and good evening, colleagues. I trust that you can see my screen.
Yes.
Perfect, thank you. Yes, so as I've been introduced, my specialization in education is instructional design. And instructional design, everybody asks, what is that? You know, so just to put it simply, instructional design, it's the design of instruction. So all types of learning materials, assessments, the rubrics, so designing all these artifacts that educationalists interact with on a daily basis. And then we take it a step further than instructional design, what they've called in modern settings, learning experience design, which deals with the experience of the learner. So personalization, the activities they participate in, and there's many frameworks around instructional design and learning experience design. And I think if you look at the graph and the definition, I think everybody in this room can resonate to some of these activities. We all design PowerPoints, we all design assessments and rubrics. So I think by that definition, everybody in the room is an instructional designer, which is a central part of the educational practice and what makes this topic so relevant. And as instructional designers, we can probably confidently say that this is what we feel like, that AI is taking over the world. And its implications are widespread, not just in instructional design or in education. In every industry, it's being revolutionized. You can see across marketing, commerce, sales, AI is taking over the world. And that's really got a lot of people having so many mixed feelings, you know, so some of uncertainty, some of excitement. And there's this video that I just want to share that almost resonates that feeling.
Tonight we'll hear the story of Crispy Bear. A long time ago, this little bear was alive because she listened to her father, so she was happy. But Crispy had one terrible problem. She was filled with curiosity. Yes, and one day she saw something new and died.
Just like that?
Yes.
Same ending as every day.
I get it, Dad. I will never do anything new or different.
Good man, Thunk. Tonight we'll hear the story of...
You know, and I think that almost outlines sometimes the attitudinal dispositions when it comes to new things in any contextual setting. And it's really about dealing with resistance to change at some level. And one of the big questions that we've asked is AI good or is it bad? And in many conversations, we'll find the room divided by good and bad. And I'm going to say upfront that I'm optimistic about this, and I'm going to say that I'm team good. Team AI is good. And yes, there are dangers and concerns, but I fundamentally believe it's a good thing for society, for education, for progression, and for development, for creating equity and justice. So I'll just state that up there, and I welcome objections and diverse points of view. But on the bad side, we got dilemmas such as this. Can anyone see which is the real and which is the fake? One of them is a real photo and one is created as a deep fake. So that's pretty much it. So we can see that it's, when we speak AI and technological development, it's just a minefield. So there are some pertinent implications that I'd like to outline in the education space. The first one is the attitudinal shifts that are required, and particularly dealing with uncertainty and resistance to change. We've got a situation where we're dealing with so much deep fakes when it comes to writing, assessments, assignments. It's so extremely hard to know what's real and what's not. You know, we've got issues of plagiarism where we've experienced, in some cases, students outright use ChatGPT to answer assignments in exams and that type of thing. And this now begs the implication of how do we create learning experiences differently that AI cannot answer? And that's where Mr. Kram was alluding to, what do universities do differently? So how do we position ourselves in a way that AI can't do our job? And I think that almost forces us to reevaluate the epistemic question of graduateness or graduate attributes and how that translates into learning and teaching. So ultimately, information literacy is now more crucial than ever. Teaching students how to determine the quality of AI outputs. And as Rian has also stated in the beginning, there's many affordances for AI and learning. And this is why I'm particularly team good. AI is good because it allows us to do so many amazing things that we could never do in the past, or things that would take hours can be done in like a few minutes. And I think that's a really good thing for education. It helps us make informed decisions. We can pick up learners struggling very early on due to advanced analytics. We can provide personalized pathways that are less resource intensive. So that's the reasons why I'm very pro AI as a good thing in education fundamentally. So there are some general considerations that we can discuss on a broad level. It deals with privacy and security, equity and accessibility, the ethical use, the role of the teacher now, which is probably changing and morphing into something new, quality and reliability. And then we use some tools, practical tools like safe exam browsers, AI detection software, and very importantly, the development of legal and disciplinary frameworks that now come into play. So in order to use AI, like I said, there are so many uses: gamification, tutoring systems. We use it to create rubrics and curriculum maps and so forth. And everybody's worried about, is AI going to take my job? And the straightforward answer is that AI is not going to replace educators, but educators who use technology will probably replace those who don't. So it's important to equip yourself with all the tools in your toolbox, and there are so many amazing tools to do so many things. So I would encourage you to explore these tools. But just this is where I pause for the important point, is that before we get carried away with the technology questions, we need to remember the fundamental principles of learning. And those principles of learning, or the universal design learning guidelines, really ground us in how we apply the nature of all these technologies. So just coming back to another question, have you actually used AI in your educational practice? If you haven't, I wouldn't be a teacher if I didn't give homework. So here's a small homework activity just for you to try and use some of these prompts, type it into ChatGPT, and it will give you an understanding of how sharp and almost amazing this AI technology is for the educational landscape. And I will end once again just stating that the fundamental question is not about technology. It's still about education. And that question remains, how can we improve the quality of education? Perhaps in this case, through the use of technology. So before we get too caught up in the technology question, let's remain with our focus on education. Thank you.
Thanks, Raiz. I'm hoping that the audience is getting their questions ready and warmed up. as we move to our last speaker before we move into the panel discussion. So our next speaker is Daniel, also from Nelson Mandela University. And Daniel's going to speak about the ethical implications of the use of AI more broadly in HPE.
Sorry for that, colleagues. Thank you, Dr. Van der Venter. Can you see my screen?
I can see your screen, yes.
Oh, fantastic. I want to say just a quick background. I am in the profession of emergency medical care. I've been at the Faculty of Health Sciences and Higher Education since the latter of 2017, but full-time in 2018. I see myself as a reflective practitioner and also a reflective academic. My key job description is to lecture. And with that bit of background, I am, as a person, as a working professional, I don't settle for the standard norms. And I very much appreciate what our Prof. Treter introduced me, that she said that I like to be innovative. And I think that is very, it ties well into tonight's topic, AI, or the use of AI and the ethical implications of AI in health professions education. Whenever something new comes into an organization, there's a natural, almost like a bell-shaped curve, where you get the early adopters, the majority in the middle, and the late implicators coming a bit later. So with the whole, for example, those that follow a bit of the crypto field, there was quite a big hype when crypto and cryptocurrencies and those kind of things came into play. And I think similarly with AI, as we understand it now, can be seen as different things. And I think one needs to grasp that. So to just touch base on what the previous speaker said, I like what Mr. Neil Kram said. We are in the profession of health education, healthcare education. Looking at health professions education, we've got different professions, different schools, different departments. In the end, our, if I can call it, our students is our product. Having the end product in mind, we all have the objective to qualify good and the best health care practitioners at the end of their diploma or degree, postgrad, going forward. We are sitting in today's day and age with the internet, now today with AI. We are sitting with a modern student. We need to equip our students to be ready and use, while being a student, to be equipped in the area of digital literacy. So that's a term from literature. And more specifically, if you see right at the bottom, we need to now prepare our students for AI digital literacy. Now, what Mr. Khan said, for example, is very important. Education, the framework, how we teach, the theories of learning and assessment, that stays at the core. AI, as we now, let's say, if we can define it as the use of generative AI models like ChatGPT, in essence, it's a global large language model. So if you do a short course on the basics and introduction of AI, you can get a better understanding. In the context of AI in health professions education, my little topic tonight is looking specifically at the ethical implications the ethics we need to keep in mind as academics, as educators, developing students in their professional capacity so that they can have the professional attributes that we want and that each profession's board requirement has. Now, there's three elements that I want to highlight. At the top, health professions education, we still have patient safety right at the top. Our end user, our end beneficiary that receives the, call it now, the treatment at the end of the day by our healthcare practitioners is the patients. So patient safety should almost always be on top or at the back of your mind. How we educate our students speaks to the educational integrity, the quality of our educational frameworks, the content, is it evidence-based, up-to-date, evidence-based guidelines, so on and so forth. And then also the professional development aspect, speaking to, we need to obviously to pass our curriculum outcomes. The student needs to have that clinical competence in knowledge, in practical hands-on skills, and so on and so forth. So that's the concept, if I can term it, navigating the new knowledge landscape. So on the topic of AI, like Mr. Dr. Van der Venter said, we have actually been using AI knowingly or unknowingly. Whenever you search for something, be it in Google, be it YouTube, be it on a research database, using other paraphrases like Grammarly and so forth. Now also AI, large language models like ChatGPT, GPT, generative language models. Whenever you attach a profile to one of these entities, and let's take Google, which is the biggest. Google owns also YouTube. These are run with AI algorithms, and without maybe some of us knowing it, AI has been part of our internet lives, our professional lives. Like, for example, Prof. Tritter, when she did that screenshot of when she went and Googled AI or ethical implications of AI in HPE. Understanding where these databases are coming from. So these databases, let's take Google, for example. They are based in the US. Most of our research databases also is based in the global north. Global north, I mean, the US, Canada, Europe, that's about 80% of what we have access to anywhere in the world. Maybe not China and North Korea. But if we in South Africa go on Google and we search for something, there's AI algorithms that feed us information that almost we can't have control of. And that's a big ethical implication in terms of when we look at our local African or South African context. Let's take the Eastern Cape with very specific local cultural burden of disease issues. That's key areas that we need to take into context when we are using the Internet of Things, be it search platforms like Google or YouTube, or now using generative AI search agents like this Perplexity and so on and so forth. So to understand we are already using AI. If you have ever used ChatGPT before or not, you already have been using AI. So we need to use it better. A quick overview, the big key leaders, OpenAI, Anthropic, Claude, Google, Gemini, Meta, Llama. Meta, you know, is on Facebook, the new company. And coming back to those three things, I can term it the ethical triangle, having patient safety, educational integrity, professional development of our student in mind. Everything that we do, so let's speak to the lecturer or the educator. When we want to update our literature, our teaching content, our lecturing content, we need to keep in mind, okay, where is this information coming from? Balance is crucial, and right at the very top or at the right very end, patient safety remains powerful. So to follow agent or agency specific guidelines is safer, if I could say that. For example, if you want to know what is the latest evidence, resuscitation protocols, we look to, for example, the Resuscitation Council of South Africa. That is again based on the American Heart Association and the European Council, which is again Global North. But those are systems we can say and we trust and we imply in our clinical practice guidelines as evidence-based practice guidelines. How can we use AI better? So 2 triangles, left and right. Sorry that it's not maybe a bit more visual. But when using AI, considering the ethical implications, benefits, research support, we can generate content so much quicker. And we can, to some extent, validate our content. The challenges or the downside of using too much of AI, and this now comes down to where our students use AI, it can limit critical thinking because now we AI everything. We say, AI, write my case study for me. AI, what is the local burden of disease trends in the Eastern Cape of South Africa? And we think without knowingly, the information that is fed back to us must be accurate. So we need to keep in mind that it may not be, and it is not guaranteed truthful facts. But yeah, I am also going way over my time. But to end off with this, when we use AI, we need to be intentional. Like Mr. Neil Kramer said, we need to stay informed. And our end beneficiary would be the patients at the end of the day. Thank you.
Thank you, Daniel. So we're going to move over to the Q&A session. I don't see any questions in the chat yet, but I have prepared some beforehand. So I'll start with those. And if there's anything someone has wondered about or anything we've said stimulated a thought that you're still unsure of, please post those in the chat. We would love to hear those and engage with them with the time that we have left. So for the 3 speakers, and I'll start with Raiz on this one, is how do you think we can prepare students and staff to use AI ethically?
Thank you. Well, my perspective is that you can't speak about, like somebody said, there's no such thing as business ethics. it's just ethics, you know. So it's about creating a culture of ethical conduct. It's about the integrity woven into who you are. So whether you choose to use AI ethically or not, AI is the tool, but it's the integrity and the graduate attributes that we instill. So as time changes, those attributes will still stand the test of time beyond the technology. Number one. Number two, it's about outlining good practices of using AI. We're not saying don't use AI. We're saying use it, but don't use it and pass it off as your own, because that's unethical. So just to outline what is ethical practice and what's not. So just giving students clear guidelines on what's acceptable practices and what's not acceptable. I think those are the 2 points I'd make on that. Thanks.
Thanks, Rais. Quite interesting points and showing that the basic ethical principles is not going anywhere. It's going to underpin what we do when we engage with AI and our own moral compass, like you said. For Neil, there's I think this one is very pertinent to you. The question is, have you used any interesting or novel AI tools, and in education in specifically? So if you can maybe give an example, if you have.
Sure. So I mean, let me rather flip it the other way around. I think if you know what you want to do, I think there's a way to do something with it. For example, in our pharmacy programs, I worked with one lecturer to create a tutor. All right. Now, it sounds super fancy and complicated, but all we did is we used ChatGPT, and we created a chatbot that would answer questions in a particular way. And that was something to help students revise certain content. What we did differently is we already fed it the content we want it to engage with. So immediately if you start doing that, you start cutting out the bias and those things, because it draws on the information that you fed it. So it was a really useful tutor. It's a program that we definitely want to continue with, and we'll probably do it again next year. Also, what we're trying to do also around pharmacy education is to build a virtual patient, all right, that would ask, you know, the average type of question that patients would ask, especially walk-in patients. You know, I've got a headache, I drank this, I need something for that. And hopefully the students would pick up if something shouldn't be mixed. So that's been interesting. What we've also used is Google's Notebook LLM. I mean, that has really been a game changer. And this is not just in pharmacy, we've used it in other spaces as well, where we've created little podcasts based on certain, you know, pieces of literature. And we played it for students, and in class we would start a debate. And we would show them what this thing does well and what it doesn't do well. So you're infusing a bit of AI literacies, but you're also getting students to actually evaluate the content that this creates. Obviously, it relies on them having read the work, and us showing them the principle of that knowledge we want them to grasp. So there's definitely really interesting ways to do it. And I mean, the simplest one to start off with is ChatGPT. For about 400 Rand a month, you can create anything.
Cool, thank you. Yeah, and I see there was a question about Notebook LM, and I think you addressed that one. So thank you for that. There's another question about using AI to edit and improve academic writing. And Zitandile wants to know if it's an aid or could it possibly limit learning of good writing skills, especially for writing treatises and essays. I'd like to give a stab at that question. If we think about the editor in MS Word, we all use it every day, predictive text on our phones. So if we use AI, in my view, to help us edit our work, proofread it, if it helps us generate some ideas, but you don't give it off as your own, you really use it as an aiding tool, I don't see an ethical issue with that, but you can't let it write your full document for you from conceptualization phase right through and say, you have written that. So I think we need to make that particular distinction with using it when we want to use it as a critical reader or an editor. So I think that's okay. The other thing is, especially at Nelson Mandela University, to be mindful of any institutional Gen AI use statements. So we have one where it says you can use AI for idea generation. You can use it to look into your work, but you have to acknowledge that you've used it. Which sections of your work did you use it in, and what did you, why did you use it? And then declare that. And then also when we go to publication, to remember that AI is not an author. Most journals don't give it authorship, and we need to be mindful of those type of things as well. And then in closing for the questions, I'll start with Daniel on this one. And if you had to give the colleagues in the room a tip, one tip or two, to successfully implement AI or adopt it in their educational practice or assessment or anything relating to their work, what would that one or two tips be?
From my side, firstly, I think from an institutional perspective, from a faculty perspective, down to your own department, somebody said in the comments, it's this unexplored, unguided terrain that we've got. So that my subtopic theme, navigating this AI landscape, I think we need set guidelines, and we shouldn't sit back and wait for somebody to give it us on a spoon. We need to be innovative. We need to be curious. Like that video that Mr. Khan shared. We need to be curious. We need to be innovative. We need to develop our own landscape platform. Practically understanding the limitations of generative AI, that will come with time. So, for example, I've been using it since March 2023. And I've got my opinions about ChatGPT. I prefer Claude from Anthropic. It's much more ethical, it's more private, and you can literally ask the AI to teach you, to explain things, to how to use it. And then you can use AI to generate, for example, how Mr. Kram said, to generate AI tutors that can support you as a lecturer or to support the students. Yeah, many tips.
Okay. Rais, a tip from you?
My one tip is please attend all the faculty workshops, because I know LNT, all the faculties are doing a lot of work in the space to get it out. So please attend them, network with your colleagues, and have fun. Have fun while you play.
Thank you very much. And then Neil.
Yeah, I think if there's one tip that I would say, if you've never used any of these, I think sign up for them. You know, think about how this is going to influence your discipline. But just get out there. I mean, the people that have been the best adopters have actually been the people that were most skeptical about it. So yeah, do it. It's not going to replace you as humans. It's really just going to augment your intelligence. And yeah, I mean, go out there and speak to people. Yeah, there's many of us around.
Thank you very much. So bottom line from what everyone has said is, firstly, dare. Don't be afraid to try. And if you don't know, that's how most of the learning happens. That's how all of us that spoke tonight have learned about it through trial and error. And you read the T's and C's and empower yourself, which is the second one. And then number 3 is just give it a go. You'll never know until you have actually tried to play with it, and you'll only really realize the power of AI once you have actually engaged with some tools. And there are so many of it. You don't have to use the most complicated one. You can start with ChatGPT, for example, and play around on your phone to see what it can do. So with that, I hope you found this little seeds that we've tried to plant useful and stimulating, and that it makes you think of your own practice for future or immediately. And yes, it's going to take time. With change, there's the time factor, and with change comes ups and downs, and we will just embrace it like we've embraced everything else that has happened through all the industrial revolutions that we have encountered. And with that, I say thank you, and I will hand over to Prof. Trita to do the closing.
Thank you very much, Rian and colleagues. And I will be very short because I'm mindful of the time. So I just want to say thank you very much to our 4 speakers tonight. I think we've learned a lot. I think there's still a lot to be learned. And yes, from my basic Google search last night, Rian or somebody from Shared Services, Philip, how did we arrive at this advertisement and the picture? Can one of you just comment on that, please? Rian or Philip? How did we get to this advertisement
I
for
can
tonight's webinar?
explain a little bit. So I've intentioned, Prof, can you hear me?
Yes, we can hear you.
Can you hear me, Prof?
Yes, I can hear you.
Okay. So I intentionally asked Matthew to use AI to generate an image for the invite and see what comes up when he types in the topic of the webinar. And if we look at that particular image, we can also see the other side of AI when it comes to a bias, when it comes to the model actually drawing from what it has been taught with. In the sense that if we think ethical, it immediately took health and ethics to create this picture. Because if we look at education, we could argue the pen pointing to a particular part on the little robot lying down is the teaching part. But mainly it took main phrases that it is used to then create what it then understands with those terms that it can draw from.
Thank you, Rian. So that was just a little bit of background. So from the very basic Google search to generating this picture. Colleagues, with this, then we tick the box of webinar 4 for 2024 we have completed. That is what we have set out at the beginning of this year for our SAAHE Eastern Cape chapter. All we can say to you tonight as from our committee is watch the space for next year. There's a lot more exciting things coming up and a lot more interactive things also planned for next year. And with that, I want to thank all of you for your attendance tonight, and we wish you really a good festive season and lots of rest so that we can come back refreshed and full of energy in 2025, and that we live our dream in health professions education. Colleagues, thank you very much for your attendance. We're going to end here, and those colleagues who are attending our annual general meeting of the SAAHE Eastern Cape chapter, there's another link. We will see you within the next 2-3 minutes on that link. Thank you, colleagues, and with that, I close the meeting. Thank you.